Hello, Yuba-Sutter community. Today I want to talk about what is called COVID long haulers, or otherwise known as post-COVID infection syndrome. So the perception is that if you don't need hospitalization, you're going to quickly recover from a COVID-19 infection. It's going to be maybe a week or 2 weeks and then you're done and then you're back to normal. Unfortunately, as we learn more and more about COVID, that's not the case for everyone. 1 out of 5 young people, age 18 to 34, can have lingering symptoms post 3-week mark of their initial infection. And what are those symptoms? They're actually really hard and really stressful. It could be chronic fatigue, chronic headaches. You can also have inflammations where you feel like you're having chest pain and you're thinking it's a heart attack, but it's actually ongoing inflammation of the blood vessels in your heart. Or you can have inflammation in your brain, and that potentially can lead to what we call the TIA, or a mini stroke, or even a full-blown stroke. So these are real. And as we learn more and more about this virus, this is really serious. So this is not meaning that they continue to be infectious. They remain non-infectious after 10-day mark. However, when your body revs up in terms of its immune system to fight off any virus, whether it be COVID-19 or another virus, it still has the army, the immune system still is there, and then it doesn't ever actually back down. And that's what we're finding, that the inflammatory system is still revved up and causing a lot of these symptoms that don't go away and last not just weeks but months now for a certain sizable population who are infected. So this is serious, and this needs to be kept in mind. It's not just a once and done short illness at all. Speaking of once and done, I wanted to let you all know that I recognize that people are really fatigued with all this stuff, and unfortunately we're still in the purple tier, but we are making progress. The case counts is coming down, the test positivity, at least on the Sutter County side, is coming down. But we need to not be complacent. We need not to see the initial progress as, yay, everything's done and we can just go back to previous pre-COVID. We actually need to continue to be vigilant, continue to adhere to the foundation, which is don't even show up, don't even go into public if you're sick, don't go to gatherings, wear your facial covering, socially distance as appropriate from non-household member, so that we can drive down the case count, drive down the test positivity, so we can go from purple tier to red tier. It's not impossible. You know why I know that? Because another North State county, El Dorado County, they're in the red tier, and their population combined is higher than that, their population is higher than Yuba and Sutter counties combined. If they can do it, and they are in the red tier and actually on their way to the orange tier very soon, we can do it, but it takes all of us. It's not up to me. I know you hear that a lot from me, but it's true. It's not up to me. I educate you all. I give you the tools to know what to do, but it's up to you. Each of you have the willpower to adhere to the tenets or not. So please do, so that our businesses can open, but open in a safe manner. Because we don't want outbreaks in our businesses. We don't want cases to occur in any sectors of our businesses. We want them to open, but we want them to be able to open in a safe manner. All right? Thank you for your time. Take care.